You're listening to the Good Question Podcast with Richard Jacobs. Our goal is to make each of our guests exclaim, that's a good question. I don't know the answer. Because when that happens, it means you, the listener, may be inspired to learn more beyond the interview and to ask great questions yourself that lead to new insights. In this podcast, we cover historical and current anthropology, comparative religion, and history. Welcome, and let's get started.
Hello, this is Richard Jacobs with the Good Question Podcast. My guest today is William Bruno, MD. He's a board-certified plastic surgeon, and we're going to talk about how you can affect someone's longevity and health with aesthetic medicine, with plastic surgery. So Dr. Bruno has over 10 years of experience. He's board-certified, which is definitely a higher level of a doctor than just your run-of-the-mill doctor. So, and he's performed thousands of cosmetic and reconstructive procedures in West Hollywood. So let's talk to him, and welcome, William. Thanks for coming.
Thanks for having me, Richard. I appreciate the opportunity.
Yeah, tell me a bit about how did you get into plastic surgery and why?
Yeah, I always wanted to be a doctor since I was a child. I had rheumatoid arthritis when I was very young and was in and out of doctors' offices and hospitals. So I actually ended up in not minding going to the doctor, unlike many children, and then became a physician. And along the way of training, I really liked surgery. So I did general surgery residency. And during that residency, I really admired what the plastic surgeons were doing as far as reconstructive, cosmetic, operating on men and women, young and old, literally from head to toe. So I went into that specialty, which we did a lot of reconstructive and cosmetic. And now my practice certainly has evolved into more of a aesthetic practice, doing, mostly outpatient surgeries, breast augmentation, tummy tuck, breast revisions, liposuction, things of that nature. And then along the way, started to develop an interest in wellness and longevity after having a personal sort of health scare where I found I had coronary artery disease based on a calcium scan, which led me down this pathway of changing my lifestyle, my exercise, nutrition, sleep, etc. Then along the way, sort of sharing these tips and all this lifestyle advice with my patients, because I noticed my patients, in addition to just wanting to look better, they sort of needed more assistance that they weren't getting from their primary care doctor. So I thought I could help them along the way. And that sort of led me to develop a digital course, a wellness and longevity course. And now I do some longevity and body recomposition coaching virtually with patients. But that's just a little summary of me. I'm a practicing plastic surgeon. I do surgeries most days of the week. And I also do the wellness longevity coaching sort of alongside that.
Do the two ever intersect? Because I just, again, knowing nothing, I wouldn't see how like rhinoplasty or breast augmentation or tummy tuck or whatever would have anything to do with longevity, but does it? Can it?
It can, because, I see patients, like a lot of my patients are women. So I'll see middle-aged women coming in, for example, let's say for a tummy tuck, and then in reviewing their blood work for them to be cleared for surgery, I just kept noticing how unhealthy these patients were, whether it was their cholesterol, their blood glucose, and that, a lot of people out here go to large HMOs like Kaiser and they just weren't getting the attention that they needed. So not that I'm a primary care doctor, but I'm still a physician, first, plastic surgeon second. So I would give them advice and give them sort of lifestyle counseling. And it was just shocking to me to realize how little direction, I guess, patients were getting from their primary care practitioners. And I thought I could at least step in a way or point them in the right direction, even though they were just coming in, let's say, for an aesthetic improvement of their face or their body. I was trying to give them some advice along the way. And that really led me to develop some more structured, organized programs like a digital course and a virtual coaching program. So yeah, some people just want to look better, but I think most of them want to feel better and live longer, even though they don't always verbalize the living longer part.
So because they feel better, because they think they look better, now they're going to take care of themselves more? Is that how the two intersect, or are there other ways that we haven't talked about?
Yeah, that's one of the primary ways. I notice after the patients undergo their aesthetic procedure, they're sort of more inclined to want to not only maintain the result they have, but improve upon that. And, whether that's starting to, exercise more than they did in the past, whether that's changing their diet, whether that's, using targeted supplements, whether it's maybe getting started on some peptides. So it really serves as I guess you'd say, as a springboard into their sort of interest into longevity. But, I think longevity is, a lot of people think of it as living longer. I just look at it more as improving someone's health span, which is the quality of their life more so than the length of their life, which would be lifespan.
Yeah. How many, I don't know if you have any data on this. How many years of a person's life, and I know everyone's different, but do they tend to spend, being incapacitated or an invalid or just a major loss of function where they can't really enjoy life very much?
Yeah, it's a good question. Most of the data is about in America, at least, speaking specifically to the United States population, it's typically the last 15 years, so the last decade and a half to 2 decades that most patients spend in a poor quality of life. So for example, the average lifespan in the United States might be, let's say it's 78 years old. That's probably for women. Maybe men is like 74 or 75. So most people might be healthy up till their early 60s, let's say 63. And then that last 15 years, 18 years, what have you, is usually spent in poor health, whether that is not being able to live independently. Maybe people towards the end are in a nursing home, maybe requiring a lot of assistance for activities of daily living. So to your question, I would say it's on average the last 15 years, let's say, of a 78 to 80 year life. So
that's crazy.
Yeah. And
that's a huge chunk.
It is. It really is a significant part. And what I've discovered is we have so much direct control over that. Like even if someone starts, let's say at the age of 50, changes their lifestyle, let's say they stop smoking, they lose weight, they sleep better, eat better, start doing more exercise, you can even at that age add a good 15 quality years of life. So it's never really too late to kind of make changes or, to get started if that's the case. But ideally, if you could start in your 30s and 40s, it makes life a lot easier in your 60s, 70s, and 80s.
Yeah, definitely. Well,
yeah.
What, I don't know, is there any correlation between the type of procedures you're doing or the procedures people want and their health circumstance or their mental outlook? Anything that jumps out at you?
Even something is, let's say, direct as I do a lot of, these so-called mommy makeovers, for example, which would be, let's say, breast augmentation, breast lift with a tummy tuck, trying to restore a woman back to her pre-pregnancy state. Even a surgery like that, which of course it's primarily cosmetic, even though in some cases you're fixing someone's abdominal wall, which does help with their posture and can alleviate some back pain, that procedure does improve their mental well-being. It does improve their self-confidence. And I think I see that spilling over to other areas of their life that can help improve maybe their relationships with their significant others. Maybe it helps improve their performance at work, for example. But I think those are sort of unintended side effects because most people come in and they just see something physical in the mirror and they don't realize that once you fix that, physical issue, so to speak, it then becomes something that they never even counted on, that they have so much more self-esteem and much more positive outlook.
Well, that's really good. Well, that's excellent to hear. Are there any other procedures that have, dramatic effect on people's outlook of themselves?
No, on the outlook, I wouldn't say necessarily. I think, there are some cases of, bigger reconstructive procedures that I had done in my training where, someone maybe didn't have the function or the use of, let's say, an arm or a hand, and that is significantly different than doing a tummy tuck or a breast reduction on someone. But those kind of procedures, again, they're reconstructive, sometimes requiring multiple stages, but that is having an even more profound impact. Like if someone, for example, loses a few fingers or loses a thumb on their hand and you can restore that dramatically changes, the quality of their life, makes them more productive at work and society and so on. But for what I'm doing now is mostly, 98% elective cosmetic procedures. Although that being said, for example, doing a breast reduction, which is covered by health insurance in some cases, that's a really functional improvement for a woman who might have neck pain, back pain, shoulder pain, and in a 2 or 3 hour surgery, you can completely alleviate them of those symptoms and they can go on to have a more, productive and happy life.
I don't know if it's kind of out of left field, but yeah, you always see those people that are like plastic surgery nightmares. They look crazy. They look like they had 100 procedures and they just look like not even human. Have you ever had patients that they were headed that way or talked to you? Like, why do people get like that sometimes? And why do surgeons do the surgeries when they probably know this is just going to make the person look even crazier?
Yeah, I certainly see people like that, being here in, Los Angeles, where they may have had multiple surgeries, maybe they had complications, and they're just striving for some sort of ideal that in my opinion, you have to know when to say no to these patients. And unfortunately, there are surgeons who should have said no, 2 or 3 surgeries prior in some of these cases. And I don't know, I think there's a lot of influence in social media and the media in general. A lot of, especially younger women I see, and they'll have very unrealistic expectations, whether it's about the shape of their waist or their buttock or their breasts or their face. And they'll come in with very unusual requests. And at least in my position, I say no to a lot of people, but because there's so many plastic surgeons and so many non-plastic surgeons doing cosmetic procedures, if someone really wants something done and they keep asking, unfortunately, someone will do it. Or, in this part of the country that we're at, people go to Tijuana, for example, and they might get something done by a physician in a facility that isn't, certified, and they might not have a great outcome there. So yeah, it's hard to say. I think people are really influenced by what they're seeing in television, media, internet, social media. And it's really I think it's the responsibility of the surgeon to guide these patients and really say, you've had enough, or, to say no to them. But yeah, it's sad to see. I know the kind of patients that you're thinking about or that you may have seen yourself in the real world. And I don't know why, but doctors just need to get more comfortable saying no.
What are just a few? What are some of the weird things that people wanted or unrealistic things?
A lot of people might want like a really small waist, and they'll pursue having rib removal to achieve that, combined with, very large buttock, right? The so-called Brazilian buttock lift. Although it's not as popular, let's say, as it was 10 or 15 years ago. I think Kim Kardashian made that very popular and other celebrities. But now I think having a really small waist, I guess, is popular. I think even young people now wanting to do like, face and neck lifts, people in their, 30s, which is very young for that. And it's driven by, they see certain celebrities, they want to see their, this cat eye look where the outer portion of their eyes being elevated up, eyebrow area. Those are probably some of the more common things that I would be seeing now, or patients are at least inquiring about. But, for the most part, most people have reasonable expectations, and most people have reasonable requests. But I'd say, there's a certain percentage of the population, maybe 5-8% have this body dysmorphic disorder, whereas, what they see in the mirror isn't what you and I would see in real life. So you have to sort of, keep your eye out for those patients, because they might look normal to you or I, but then they think they're overweight, or they think there's something wrong with them when physically there really isn't. But that's just a few examples of kind of what I'm seeing.
Well, any new procedures that are up and coming that are starting to be requested a lot, or that you think are interesting or have the potential to like really improve someone's life or make them look really good?
I think with the advent of exosomes and stem cells, I think it's really helpful. There's some aesthetic, indications for that, whether that's improving skin, but on a more impactful level, using them for, let's say, spinal cord injuries, orthopedic injuries, joints, direct injections, either exosomes or stem cells. And I think once that becomes a little bit more refined, because right now it's hard to source those, you see a lot of patients going out of the country to get stem cells. I think once this is sort of managed within the United States, and more centers become certified and credentialed for this, I think that is going to be really the future of sort of regenerative medicine, where beyond plastic surgery, even just improving people, whether it's their vision, cognitive issues, helping with Alzheimer's, helping with, autism, and a whole spectrum of, illnesses and injuries that can be treated with stem cells. And I mean, there's certainly some overlap there with regenerative medicine, plastic surgery, but, other specialties using it, orthopedic, neurosurgery, and, many other specialties. So I'm excited for that. In addition to peptides, these peptides are gaining a lot of popularity, for example, not just the weight loss peptides like Mounjaro and Ozempic, but peptides to promote wound healing, peptides to promote skin health, cognitive health, body composition. So that's a really exciting field too. And again, that needs to be regulated as a kind of a gray market. You can go online and buy peptides, but you don't really know where they're being sourced from. So I'd say those two areas are really exciting. And I think we're going to see a lot develop in the next 5 to 10 years.
Okay, very good. What's the best way for people to find out, that want to get this reconstructive surgery or plastic surgery? Like, besides just calling random doctors and just ordering it off a menu, how do people really research what would work, what shouldn't work, what the trade-offs are, those kinds of things? How do you do this responsibly?
Yeah, I think if anyone is, interested in a plastic surgery procedure, whether it's aesthetic or reconstructive, I would recommend that they look at the American Society of Plastic Surgeons website, ASPS, or they can go to the Aesthetic Society, which is, these are both board certified plastic surgeons in the United States, and they'll have a directory. So if you want to find someone close to you, depending on what state you live in, you can sort of enter in your state and you at least know that they're certified by the American Board of Plastic Surgery. And then, my advice, I tell all my patients, even if you're coming to see me for a consult, see at least 2 or 3 surgeons. You want to see how their style is, how their staff is. You want to make sure they have good, before and afters reviews. And most importantly, make sure that they're comfortable and skilled at doing the procedure that you're interested in. So like some doctors, let's say, specialize in facelifts. Some doctors specialize in hand surgery. Some doctors specialize in, breast and body surgery, sort of kind of what I do. Some guys just do rhinoplasties. They just do noses. So it's important to know that. But I would look at those 2 societies, the Aesthetic Society and then the American Board of Plastic Surgery. Those are great resources and they can point in the right direction.
Well, very good. Well, Dr. Bruno, thank you so much for talking about this. And I appreciate you being on the podcast.
Yes, thank you, Richard. I appreciate it.
If you like this podcast, please click the link in the description to subscribe and review us on iTunes.
Thank you for listening to the Good Question Podcast. Please email support@thegoodquestionpodcast.com if you have any referrals to great guests for us to interview. Visit thegoodquestionpodcast.com to hear more interviews. And please help us spread the word by rating and reviewing us on Apple Podcasts, iTunes, Spotify, YouTube, or wherever you listen to this podcast.